This is Heather Edmonds, Program Associate with the National Aging and Disability Transportation Center. Welcome to the session on multimodal approaches in accessing healthcare services. I'd like to welcome Harmony Lloyd, Chief Operating Officer of Planning and Innovation at the Mass Transportation Authority in Flint, Michigan. Since joining the MTA, Harmony has been involved in several key initiatives, including Rides to Groceries, a transportation program to connect residents in food deserts to grocery stores, and Rides to Wellness, a project to improve Flint residents' access to transportation for health-related care. She's currently the panel chair for the TCRP Guidebook and Research Plan to help communities improve transportation to healthcare. She earned her bachelor's degree in political science from University of Detroit Mercy and has her master's degree in public administration at the University of Michigan Flint. When Harmony is not advocating for public transportation, she and her husband are raising 6 sons. We are glad to have Harmony bring her expertise on medical transportation. I will turn it over to you, Harmony.
Thank you so much, Heather. It's such a pleasure to be with you today and to share the information that we are doing in the area of health and wellness transportation here in Flint, Michigan. So I'm going to take a little time and give you an overview of the program, and then I will get into the nuts and bolts of how we run the program and how it exists. So just to get started, if you aren't familiar with Flint, Genesee County is located about an hour north of Detroit. The population of the county is 428,000, and the population of Flint is about 90,000 people. You may have heard of us in the news because we've recently had a lot of challenges around our water, and I will talk about that during the presentation and how that led into Rides to Wellness. MTA Flint is the public transportation provider for all of Genesee County. So we do have fixed route buses, regional route buses, a paratransit service, and then the specialized service Rides to Wellness. So a little background on Rides to Wellness. In 2016, in the midst of the water crisis here in Flint, we were contacted by public officials who were very concerned and needed to respond to the water crisis and be able to get Genesee County residents access to water, groceries, and medical appointments. And there was, of course, an urgency to be able to provide those services in a quicker and more efficient way than we maybe were able to with our fixed route. Quite frankly, the county and the city were in a panic, and we really needed to be able to get people to doctor's appointments to be tested for lead, to have rashes looked at, to things that were just absolutely critical to the health of the community. And so we received a grant from the state of Michigan, and they said, here's some funding, figure out how to get people to the doctors. And we knew that traditional forms of public transit, like buses, were not going to work for this situation. And so we began visiting with stakeholders throughout the community and talking to riders, to residents who hadn't used the bus service or our transportation services, to stakeholders, to social workers, to everyone we could think of to understand what type of solution we could design that would really respond to the community's needs. And what we learned was that there was significant medical transportation needs outside of what Medicaid transportation currently covered. And that was more than just the water crisis. It was dialysis. It was access to healthy foods. It was significant challenges for people that may not have Medicaid transportation, that were older adults or people with disabilities that couldn't rely on the fixed route or even the paratransit system for some of their needs. We also learned that the ride-hailing services, which at that time were becoming very prevalent in the community, had some really great qualities, but they lacked the capacity to be able to transport wheelchair passengers, to give assistance to older adults who might need more than just the ride. and others with specialized transportation needs. And so we felt like this was really an opportunity that we could create something special that would deliver a low-cost solution, but with a really high return, and really demonstrate some innovation in this area of mobility. And so we came up with the solution, Rides to Wellness, and we call it a health and wellness initiative that combines the best of public transportation with the convenience and personalization of ride-hailing services. And so what does that really mean? Well, here are some of the key elements to Rides to Wellness. We heard over and over again in the community that they wanted same-day service, that the 24-hour window that our paratransit service required was just not responsive to the realities the community had of needing to get to the doctors or to urgent care or other appointments on that day. We recognized there was an importance for more person-centered trip planning, that this wasn't just about moving something from point A to point B, but that something was a person that brought unique needs that we needed to be able to address to really have a successful program. We started learning about travel training and the idea that many people had never used any form of public transportation and needed somebody to just help them navigate learning how to use the system. And so we incorporated travel training as part of our program and offered that as a free service. We knew we couldn't do this without some improved IT applications, that if we just tried to run this system on the technology that we had previously used for our paratransit system, that it wasn't going to be successful. We needed a more modern take on how we were running our system. Door-through-door service for customers who needed that assistance. And we heard about connected trips. That was something we heard over and over, is that people wanted the option of being able to make a stop on their way from point A to point B. So really it was point A to point B to point C. And an example of that, the most common example that we see, is leaving the doctor's office and needing to get your prescription filled. On our traditional paratransit system, or even on the bus, it's going to be very difficult. You're pretty much on a trip to get home, and that's where you go. But with a connected trip, there's the option of having the driver take you to the pharmacy, wait with you while that prescription is filled, and then take you home. We knew that we would need dedicated trained staff, and I'll talk about that in a few minutes. Wheelchair vehicles. We've heard over and over that the TNCs, like Uber and Lyft, have had so many issues because they haven't been able to provide enough access for wheelchair users. And car seats. We use passenger cars for the majority of these trips, and we realized if we were going to be transporting children, we would need to provide car seats because people that didn't have an automobile would not own a car seat. And so that was something very different as a public transportation agency that we had to learn to do and to train our staff, and then being able to accept credit and debit cards in the vehicle. And I'll talk about that in just a minute also. So oftentimes when I describe this service, people are trying to picture it and understand what it really looks like. And so I have a video.
Missed appointments, not making it to the pharmacy or other follow-up healthcare destination. Lack of transportation is a key barrier facing those trying to navigate the complex world of healthcare. A new service from Flint, Michigan's Mass Transportation Authority is working to fill these critical gaps in the healthcare delivery system by providing a coordinated transportation solution that will improve health outcomes in the community. Rides to Wellness offers pre-scheduled or same-day transportation services designed to get people to health-related appointments and destinations at the right place and time. This service, which can be scheduled within as few as 30 minutes, features specially trained drivers that can escort riders to and from the vehicle and who will help with packages. Riders or those supporting them to schedule a ride. Rides can also be scheduled via smartphone, tablet, or computer, providing a convenient, flexible way to help keep individuals and the community healthier. The service, offered affordably, eliminates barriers to reaching the multiple destinations involved in healthcare and the associated follow-up. It reduces reliance on family and friends and ensures riders do not miss their doctor's appointments, pharmacy pickups, physical therapy, and other health-related care. Anyone in the healthcare delivery continuum can schedule a ride. Hospitals, nursing homes, caregivers, and riders by contacting our dedicated transit navigator. As part of scheduling a ride, approved car seats are used for infants and toddlers. The Mass Transportation Authority's Rides to Wellness was developed and operates in collaboration with multiple community partners. The program focuses on enhanced coordination as part of a holistic approach to improving community health outcomes. The MTA is seeking to change the conversation and demonstrate how public transportation can serve as a powerful force in the vitally important and complex issues of public health. We hope you will join us on the ride to wellness.
And so hopefully that video has given you a good idea of what Rides to Wellness looks like as it operates here at the MTA from day to day. And this is the time when people start saying, this is an amazing program. How do we do this? How do you make this happen? And so I've been able to break it down into some key elements that I think are critical as you think about how you could develop health and wellness transportation in your community. And those are meaningful and equal partnerships, broadening the concept of health and wellness beyond just the idea of a trip to the grocery or to the doctor's office, creating a premium service that people will pay a premium fare for, utilizing technology, and then the willingness to try new things, to take risks and innovate. And so in thinking about partnerships, we often hear that, collaboration is key. And I can tell you for this program, collaboration really is key. We could not do it without the partnerships we have, because the partners we have bring clients to the table and they bring funding to the table. And then we are able to provide the transportation to be that connector for them. And so we think of it with what you're seeing on the screen, just an example of some of our key partners. The riders always in the middle of every decision we make, nonprofits, hospitals, senior living facilities, the Federal Transit Administration, Veterans Services, just a few of the partners that have been critical to our success. And so as you think about it, and you think about your own community, you think about who is doing this type of work, who is there in our community that needs transportation for their clients, because every community has someone that needs transportation. And this is a list of some of our community partners, just to give you a sense of the variety of groups that we work with. A hospital system, an outpatient substance abuse treatment facility. Right now, substance abuse and opioid addiction is such a prevalent topic around the country, and so there's so much work being done in that field and funding in that field, and transportation is really a key determinant on the success that people have in going through outpatient substance abuse treatment. Cancer recovery programs or chemo programs are something that often requires transportation, and there's agencies that are working with clients to provide that. wound care, the PACE program. The PACE program is a program for all-inclusive care for the elderly. It exists in at least 38 states, and they provide daily transportation for the clients that they serve. And so we at MTA are able, through a Rights to Wellness program, to partner with the PACE program and do all of their transportation. And then private pay passengers. There's some people who are willing to pay that extra fare to be able to utilize a service like this. We're seeing it more and more as parents are aging and their adult children are often taking off work to drive them to doctor's appointments, to take them places where that parent, that aging parent, would like to be independent and is willing to pay the money to not have to ask their child to take the day off work. So offering that as an option. So as you think about this type of program, think bigger than traditional non-emergency medical transportation. That can be a great field to be in, but it also is very tied into Medicaid, and the billing and other things can be very complicated and overwhelming, especially for smaller agencies. But there's so many needs outside of traditional NEMT. Some of the things that we've seen as we've developed and grown this service are places that people need to go, like grocery stores, the pharmacy. Oftentimes we need people that need rides to government agencies like Social Security or Secretary of State, which would be like the Department of Motor Vehicles. Nonprofits, when they need to get there to be able to obtain the services of that nonprofit. Senior centers. There's just such a larger definition of health and wellness than we ever imagined when we started this program. But you think about it as not a service you would use every day, because the reality is this service costs $15 per one-way trip. So it's much more comparable to an Uber trip or a Lyft trip, slightly cheaper usually than a taxi service, but you get all these additional benefits by taking this trip. So it's not something that a person would use every day, but it is something that they could use once or twice a month to get to some of these important appointments. So to charge that premium fare, that $15 each way, you can't just offer your traditional paratransit service. You have to really create something that is a premium service to charge that premium fare. And so you have to decide in your community, what does that mean? And for us, it was that same day service. I would guess in most communities that would be one. The assistance to and from the door, people consider that a huge benefit, especially if they have someone that needs transportation that really can't get from the door themselves. The connected trips, drivers carrying bags, offering service outside of the normal hours of your transit system or your transportation system. Using passenger cars. This may not seem like a huge benefit, but the public has responded so positively by our use of passenger cars. They like being picked up in a smaller vehicle and not having a minibus or a large bus that they come to their neighborhood or have to get on in their driveway. A single rider trip, so not that shared trip of being on a vehicle for an hour while it picks up several people, and then being able to accept a credit card payment in the vehicle. So talking about the credit cards, we really needed to figure out a way that we could accept payment that didn't require a huge investment in technology. The program is so new and was funded with some pilot money that we didn't know what was going to happen. And so we started thinking about, rather than some of these very expensive fare technologies, what about just using Square? It's used by small businesses around the country, and it's very easy to use, very easy to implement on the back end. And so we started using the Square app. It attaches right to our drivers' tablets that are in their vehicle, and the riders who use that just absolutely love it. And it was very low cost, about $20 per vehicle to put that to put that technology into use. And then the agencies, the partners that we talk about, we bill them on a monthly basis. So we provide their trips, and at the end of the month, we invoice them for the $15 per trip. Another technology that was very important to many of the agencies, but primarily the hospitals, was the ability to schedule online. And so the hospital system we work with has an actual, every single computer in the hospital has an icon on their desk, and frontline staff, nurses, and patient navigators are able to click on that icon and be in the Rides to Wellness portal and schedule a trip. And that trip is immediately sent to a driver, and that driver responds. So there's no delay. There's no having nurses sit on a phone and wait in a call queue to schedule a ride for a patient. The whole process takes 2 to 3 minutes, and then they can pull up their dashboard at any time and see if the trip's been completed or where it is in the process. And this has been very, very popular with the hospital that we work with. So the overall message when you think about health and wellness is don't be afraid to try something totally different than you've ever done. Don't get stuck in the mindset that this is what we do, this is what our drivers do, this is what they're used to. Scratch all that and start by saying what would be an amazing service. And so just one of the things that to think about, or what for information, is a lot of people ask about our drivers, and are they contracted employees, are they employees of the transit authority? And so I put a few facts here about the drivers. They are all paid union employees of our transit agency, just like any other driver that we have. We do full background and drug checks, which of course is important to the agencies we work with and to the riders. There isn't any additional insurance that we have to have for this service. The drivers do go through the typical training that paratransit drivers go through, and then we do some additional specialized training like mental health awareness. And again, they drive primarily passenger vehicles, and that has made it a lot easier during these times of driver shortages to recruit drivers. Drivers are much more willing to learn how to drive a car and take people to doctor's appointments than they may be to drive a big bus. And so Rides to Wellness is one of our programs where we are never short on drivers and have had great success in being able to hire new drivers into the field. So just a picture of the past 3 years and what it looks like. That video that you watched just a little while ago was filmed at the beginning of our program. And at that time, we had one mobility manager that kind of oversees the relationship with the agencies, 5 drivers, 3 vehicles, 1 community partner, and we did 169 trips in the month of September 2016. So we thought, well, we're getting started, it looks good, people are interested. And then as people learned about the program and agencies learned about it, it absolutely took off. And so you can see 3 years later, just this month, we now have 3 mobility managers, 7 coordinators, 130 drivers, 80 vehicles, 13 community partners, and we're doing about 10 to 11,000 trips a month. It's even a little bit higher this month. Our operational costs are fully funded by a combination of fares and the state operating assistance we get. And the capital costs are paid for with our FTA capital grants and some of the innovation grants that have come out nationally and at a state level. So we've had a huge success. People love the program. And it's gotten us a lot of really positive attention in the community because people see it as very relevant and very necessary. So moving forward, if you take anything from this presentation, I hope that you'll realize that transportation must be part of the holistic approach to improving health and wellness outcomes. It's really a key indicator. And we can be an innovator, transportation providers, and we can bring a solution to medical providers in the community and say, we have something pretty amazing here that we can partner with you on. And so it's important to remember the need for health-related transportation is not going away. It's not just a Flint thing. It's not a Michigan thing. It is a country that's aging, a country that's living longer, but with more disabilities. We are going to continue to need transportation. And so now is the time to get it to work for you.